So
And
you're talking about poop pills, just to be clear. And what type of diseases could occur from that?
anything that's inflammatory. So I've seen patients presenting with arthritic conditions, joint aches, fatigue, mental fog. The gut is connected to dementia. There's even a connection to Alzheimer's disease, which is really
Come on.
interesting because they were looking at Alzheimer's in a mice model. They were finding that they were postulating, does the gut microbiome? Up to now, we think like Alzheimer's is this phenomenon that's happening in the brain, and if you have the ApoE4 gene, you're more highly susceptible to getting Alzheimer's. But they took these germ-free mice, and they used germ-free mice that have no gut microbiome as a way to test, well, what happens if we give them the microbiome from mice that have developed Alzheimer's and they have those beta amyloid plaques? Because the germ-free mice don't develop those beta amyloid plaques. So they did kind of like what we call fecal transplant in a sense. Mice like to eat their poop, so just put them in the same cage.
Mice, what are we doing here? Come on, mice. There's better food out there. Go with the cheese.
No, yeah, they eat each other's poop. So the germ-free mice eat the poop of the Alzheimer's mice, and then they looked at their brains, and the germ-free mice that were exposed to the poop of the, in other words, the gut microbiome of these mice also develop beta amyloid plaques in their brain. So there is a role that the gut plays in a lot of other aspects of our health that we haven't really been paying attention to until the last 20 years, and really more so in the last 10 years.
You mentioned, mice eating each other's poop and doing fecal transplants. I've heard of this with people we both know, and in order to improve their health, doing some type of fecal transplant because they've struggled with weight gain and they've had their probiotics and feel like they've done the work on their gut, but still weren't seeing the results. So are you seeing this? And if so, what can you tell us about that?
That's still, a lot of in its infancy. It's still something that's not FDA approved in the United States. So in the US, you can do fecal transplant for resistant C. diff infection of the gut. I don't think we've absolutely completely figured it out yet. I think that weight gain and weight loss is more complex. I mean, I see people in weight loss plateaus, when you optimize their gut and their detox systems, which is the liver, the gut, and the gut microbiome, suddenly their body will let go of weight that it didn't want to let go of for a long time. It's always like trying to figure out, like, what are the obstacles to healing?
Right.
And I think if you can remove the obstacles to healing, you can move the needle for a person that has been stuck. But sometimes if there are 3 obstacles to healing and you only remove 2 of them, but the third one is still active, you might not get the results yet. You've got to find that third piece, because our bodies are naturally healing machines. But they've used fecal transplants for treating ulcerative colitis, Crohn's disease. There's a clinic called the Tay House Clinic in London, and also they have a location in the Bahamas where they treat people and they have them go in and do fecal transplants. I know now that oral fecal transplant capsules from healthy donors.
Okay, so you're talking about poop pills, just to be clear.
Poop pills, yes.
Okay, yeah.
And anecdotally, I know someone that we both know improved their skin health by taking these fecal transplant, these poop pills.
What?
But they also claimed that they couldn't eat gluten, and that now they can eat gluten. I would want to get a little more data driven and say, okay, maybe that's true. Let's look at markers for intestinal permeability. Let's look at antibodies to gluten as well as non-gluten wheat proteins, because I have a profile that I check with a patient where we look at reactions to gluten, but we also, I bet people don't even know this, you can react to proteins in wheat that are not gluten. We all talking about like going gluten-free, like gluten is evil. Hey, but I do these tests and I find people reacting to serpins and purinins, which are non-gluten proteins in wheat.
Okay, so it's other things in the wheat, cacao. And I'm like, cacao? No, I like chocolate. Why chocolate? Don't do this to me, chocolate. I've never had an issue.